At face value, one would naturally expect modern day nursing and midwifery to be advanced and effective in its core areas such as education, regulation, practice, and professionalism.
Because the expectation really is that the more educated people you have, the better the practice they should be providing.
Indeed, there are indisputable achievements which have been made in some of these areas. For instance, the passage of time has brought with it technological advancements, institutions of higher learning, as well as higher qualifications.
Present system, if I can compare, really, it's very advanced because they have got everything. They have got information which the old nurses didn't have. And they have got equipment and specialties that they can handle a patient well enough than when nurses were giving care in the 1950s.
As we're talking now, people have masters and PhDs in nursing.
But when we compare present-day nursing and midwifery to what it was yesterday, or the qualifications that are attached to it presently, are we really making progress? Do qualifications on the paper match with practice on the ground? Lucy Nkudumula has been in the nursing and midwifery profession for a long time and has been working with the Ministry of Health since 1996.
But I can assure you, by the time we were graduating with a diploma, we were very skilled nurses as compared to the degree level nurse that is graduating today. We've got a lot of students on the clinical area. I think during our time, the qualified nurses were able to concentrate on the students. They would know us by name. They would know which student has arrived and which student has not. They would know us and they would know what we are able to do and what we are not able to do. And they would actually ask you to say, you are supposed to repeat this particular procedure because I saw you and you didn't do it well. So you would actually be picked from your group of students, your fellow students, if you have not done something very well. Nowadays, I don't think students are well known by qualified nurses because there are so many on the clinical area. They can easily slip through a department without knowing much, and nobody would know.
Associate Professor Dr. Menembewa joined nursing and midwifery as a student in the late 60s and has grown with the profession.
If I can compare the passion in nurses in the 70s to 80s, then compare it with their passion 2000 to 2000 plus, I can compare in a way that it was 50% here in the first government. In the second government, I would say it was 30%. In the other governments later, it was even reducing more and more. And I can't blame the nurses, they're doing a great job, but the factors that are hampering on the quality of nursing care are multifaceted, from top to bottom, left to right. The problems are structural, are cultural, are economic, are attitudinal, and there are so many factors.
Among other things, she highlights population explosion as one of the chief causes of problems in nursing and midwifery today.
The population has exploded too much in that even the bed state in the hospital versus the number of patients is not matching. Therefore, the nurse is overworked. When you are overworked, you don't follow the procedures, and when you don't follow the procedures, you are burnt out and you don't deliver the best to the patient. Before independence, the population of Malawi was small. Number of nurses were few, but they were adequate for the number of patients in the hospitals. The resources were enough because the population was small.
The Nurses Regulator, Nurses and Midwives Council of Malawi, which is almost as old as post-colonial Malawi itself, having been established in 1966, has helped a lot to control nursing and midwifery in the country.
The role of the council is to protect the public from any malpractice that they may experience because of use of incompetent nurses who are not safe, and then subject them to some of the things, to the care that might not be appropriate.
If the service is overwhelmed, regulation is also overwhelmed. Previously, regulation also ensured that things are done correctly in the wards, in the hospitals, in the training institutions. Of late, I would say they are also overwhelmed in that they can observe something is wrong, but how can they, for example, the practice in such a hospital is not good. According to regulation, they are supposed to close because the public is unsafe. Now they look at, if we close this hospital, what will happen to the patients? So there are all those dilemmas even at a regulation level.
The Constitution of the Republic of Malawi provides that there shall be a Nurses and Midwives Act to guide the regulation of the profession.
It's an old act. A lot of things have happened, and we anticipate more things, more changes in the profession. As such, it was very important for us to revise this act to address the trends in the profession. For example, in the act, you find that the penalties, whether if you're an employer or a nurse or any other institution or training institution, does not comply with the standards, you find that the penalties is 2 kwacha, 2,000 kwacha, Malawi kwacha, which is okay, and they are not deterring enough.
The fact that while in some areas things are worse than they were yesterday, they are better in others, makes people in the profession see a gleam of hope for a better tomorrow.
The fact remains they can be doable if we all work together. If we can have adequate resources, adequate number of personnel, train our nurses continuously on positive attitudes, close supervision by nurse leaders, I think things can change. If there is a way that we can manage our population in Malawi, we also need to look at that, because there is population explosion. We don't need to wait until people have no place to build. The hospitals are choking, education system is choking, and we are not doing anything on the population because the land of Malawi remains the same.
The overburdening of our hospitals is because we are not doing well in the communities. We are not doing well in disease prevention, health promotion, you name it. So I would want to have a vision of the healthcare that is promoting community health nursing. So we have nurses across the world in the communities reaching out, conducting home visits. When a patient with diabetes, hypertension is discharged, community health nurses welcoming that one and making follow-ups in their homes. We would want to see that happening, and we will reduce the admissions that we have in our facilities.
This year's International Nurses Day is anchored on the theme, Nurses, a Voice to Lead, a Vision for Future Health Care. Nurses and midwives think there are specific things which can be done to live this talk, especially also bearing in mind that the profession constitutes about 50% of the healthcare personnel in Malawi.
Nurses should be involved in the decision-making capacity, and they should be also given an upper hand in the development of policies, because sometimes we have challenges that those on the ground, they are not in the decision-making capacity bodies, so that what is mostly discussed in the upper levels is not what is literally found on the ground.
Let nurses, midwives be challenged with responsibilities leading to policy, guidelines, protocol formulation and development, and not being at the receiving end to implement the same.
The districts, the highest position is principal nursing and midwifery officer. That position for us, we feel that it's a bit low, quite low when compared to the central hospitals. And we feel that as we talk about decentralization, the next target should be to bring powers to that level. And so therefore we are actually moving towards upgrading that position to a higher level.
Aside from some decision-making positions that have already been put in place, such as that of the Director of Nursing and Midwifery Services in the Ministry of Health and Deputy Director of Nursing in central hospitals, there is still more to come.
There is already a functional review that is happening for the district councils, and we trust that out of that exercise, we are going to see a higher level, a higher grade of a nurse being put even at the district assembly. We have never had nurses on that decision-making table in the district assembly, but this time around, we are rest assured and we are very sure that there will be nurses now at the assembly even at a higher grade than the P7 that is currently on the ground. And that P7 is not at the assembly. That position is at the district health office, and therefore the voice of nursing and midwifery ends at the district health office and not at the district assembly where decisions are made for the district. So we are very, very hopeful, and we know that things are going